guess what? This is the first inaugural One Health Day globally. And here you are talking about how we can embrace stewardship of our very important antimicrobials. I'm thrilled to be here for that, and when I go back to George Washington this afternoon, we're going to be doing another event. It's also on antimicrobial resistance and working together. This particular day, if you go online to the One Health Commission, they have a map set up to highlight all of the incredible events that are taking place around the world as groups, small and large, come up with events to highlight One Health approach to an issue that they're addressing. And this one today is very near and dear to all of our hearts. The American Veterinary Medical Association was the first one to really pull together a task force in defining what One Health is. And it's a collaborative effort of multiple disciplines, working locally, nationally, and globally to attain optimal health for people, animals, and the environment. I'm going to show you the three major groups, and their links are below, and when you get a copy of this presentation, it's an active link, so go take a look. But the One Health Initiative started in 2006 and really did set the stage for how we can reach out and embrace and work together on this very important initiative. And you're seeing the same theme through every single one: promote, improve, defend health and well-being, specifically enhancing cooperation and collaboration between physicians and veterinarians and scientific health and environmental professionals. Again, promoting strengths in leadership and management to achieve these goals. They have embraced the One Health umbrella, and there's probably more areas that each one of us can think to add, but the whole idea is to show how we can bring many groups together with experience and ideas that we individually would not think about when you stay in your own little area. And I think the richness that comes when you reach across and work with everybody enhances and improves and actually advances things much quicker. And then we have the One Health Commission. They really have a terrific webpage up for education and showing how we can set the networks in place. They have a student webpage as well, and student groups at universities around the world have been interacting to showcase how they can bring each other together. And I will tell you, since stepping back into academia and working with the students, it's true. They are going to be the ambassadors of all of us going forward, no matter what they're training. They are so energetic, and when you put something on the table, they really do reach across the aisle and work together. And they keep saying, but I don't want to have to stay over here very disciplined in one area. Get the expertise, but they're so quick to want to reach across and work with each other. And they've all gotten some international experience already, so they have a taste of what it's going to take to continue to nurture this one forward. This particular One Health Commission, this is the page you want to go to, as I mentioned earlier, to see all the events that are taking place. And then finally, the One Health platform is in Brussels, and they have a wonderful listing again for a lot of the scientific articles and publications, far more than the first two. And they're really, again, trying to pull together and showcase where One Health, working and publishing together, is happening. And I'm very pleased to see them join. So that's their webpage as well. Okay, so the focus of this particular meeting is one that addresses where we go with AMR. And yes, you've heard this and seen this before, but Sir Alexander Fleming, back in 1928, did discover penicillin. He was knighted and he got the Nobel Prize. But he also said resistance is a natural counterpart to antibiotics. And then we had Louis Pasteur, who developed germ theory, pasteurization, vaccines, fermentation. And he said at that time, gentlemen, gentlewomen, it is the microbes who will have the last word. So you're all very well tuned in to the fact that now we have this on an international plane. There is global concern of what we will do to address AMR. And I think it really has further emphasized that we do live in a global village, and everybody has a major role to get engaged. I think we've understood clearly how much international travel has opened the opportunities for these microbes, now that they can very easily share genetic material, to be able to enter our lives in ways that we never thought possible. We used to always think if we didn't travel to a certain area, you wouldn't get a certain disease. Not true anymore. So this is enlightening all of us to say we have to be able to have a program of surveillance to see what's happening and what interactions and interventions can be taken. At the same time, we're struggling because we also have not sustained new drugs in the pipeline or a new therapeutic approach. So we really have to support the research in order to have some new countermeasures developed. And it really does threaten patient care, be it human or animal. It certainly impacts economic growth, our public health, agriculture, economic security, and our national security. And when you start to delve into this, people really sit up and pay attention. Many times a person is thinking about their own health, their family's health, and not realizing it goes far beyond that. So in 2014, President Obama decided to come up with an executive order. In fact, this should have been certainly a bipartisan issue. It should have been something that members of Congress were embracing without it having to be an executive order. But in fact, it took an executive order to try to raise the attention that we do need to work together. And it came up with combating antibiotic-resistant bacteria, which we affectionately call CARB. And here was the first step to really reach out and bring people together here in the United States, but it also went beyond international borders. And the old strategy that you've gone through in so many details, with so many meetings for the last couple of years on AMR, is still present today. And what I've done is I've highlighted some key words. And the first one says slow. We want to slow the emergence, if possible, of resistant bacteria and prevent the spread. We'd like to strengthen the One Health surveillance efforts that we're going to be involved with. How do we advance development and use of rapid diagnostics and have those available and be able to understand what we're facing on these resistant bacteria? How do you accelerate what we need desperately, the research, to develop either a new antibiotic or potentially a new methodology of genomic intervention or vaccines? And how do you then improve internationally the collaboration? I should have highlighted collaboration. How do we really, again, bring people together to work on this very important issue? Well, beyond what we've done, it's also true globally. So the World Health Organization, the World Organization for Animal Health, and the Food and Agricultural Organization of the United Nations all have agreed and have supported the 2015 Global Action Plan. Once again, improve awareness and understanding of what AMR is all about. That takes good communication, education, and training. And I understand there were a couple of psychologists that were present yesterday, and I think you had a very, very good session. But many times it's how do we slow down and how do we listen to others, how do we ask appropriate questions and gain information and basically walk in someone else's shoes to see what their needs are, because everybody's going to be a little different. And on a global area, governments and countries can do different things at different levels based upon where they are with their economy and where they are with a willingness to step up and make a difference. Number two, how do we strengthen the knowledge and evidence base that we want to gather as we try to understand AMR? And how do you then enhance the research that we need? It's very complicated. People may say, well, no, it's pretty straightforward. You have a resistant bacteria. No, there's a lot more behind that. We need to understand how this is evolving. How do you intervene? Why do we see this happening in certain bacteria quicker than others? And also, certainly understanding more so how we're seeing the transmission of resistant moieties and what that means. And how do you identify that? Reduce. How do you reduce the incidence of infection through, again, additional approaches? Can we enhance sanitation? Can we enhance hygiene? How do you be able to provide in countries developing where they don't have the luxury of a complete program of safe water, of sanitation, that we take for granted over here? So when you have to address AMR in that kind of a country, it's going to be very, very different. But they have to be at the table because it's going to influence all of us. And then how do you optimize the use of these antimicrobial medicines in human and in animal health? And when you bring a veterinarian to the table, when you bring a physician to the table to work up and analyze their patient and decide appropriately what infection am I dealing with, what drug will I choose, that's important. And we need to have the rapid diagnostics there to have that because we've all seen the case of I'm going to visit my doctor, I don't feel well, and I really expect to walk out of that office with a drug in hand or a prescription. Is that really what we should be doing? We need to enhance and educate our clients and our patients as to how we will work through and define what approach we're going to take. And many times, probably many of us are guilty. If you have had a treatment of antibiotics and you feel good, 3 days later, but you don't want to have that upset tummy, oftentimes you say, well, I guess I'm over it, I'll stop taking my medication. We need to have people educated as to why you want to continue and make sure you've completed your dose. There's a reason and a scientific basis for that, but we have to help people understand that. And then how do you do a further development, which is now the economy, to sustain all of this? Again, certain countries are going to have modalities. They can do a full Monty of a program versus those that are in between. And how do we then encourage ministries to work together, ministries of health, ministries of agriculture, to realize we're on the same page and we can only achieve this if we work together, because it's too costly to try and stay in my own little area and not reach across and work with you, because it's going to help all of us. So I was pleased to see them embrace that. And then, of course, this September 21st here at New York, we had the United Nations General Assembly. Further, they pulled a very special high-level meeting on AMR, again, reiterating that internationally it's touching all of us. And I was really pleased to see them release and adopt the 2015 Global Action Plan, which is the link that I put there for you. But they did the same thing, and yes, there's a lot of words, and I'm not going to go through them. But the reason I put that up for you to take a look at is, again, they are embracing a One Health approach, music to my ears, and they're also acknowledging you really need to have so many different groups together around the table working on this. But it's going to take an act of Congress as well, where I said at the beginning it should be bipartisan. In fact, this past year we were fortunate to see the first One Health Act, 2016, at least being introduced. It's not perfect. It needs to be tweaked. Hopefully it'll be reintroduced in the new Congress. But it's a step in the right direction. Because when it comes to working with government, we're in a perfect example of silos. And if I'm with the FDA, I have my appropriations, and it says basically for my 1 year budget, I'm going to do A, B, C, D, E. Great. End of the year, Congress says, and what did you do with your dollars for that year on A, B, C, D, E? Well, I did A and B, but I really didn't want to do D. I want to work over here with NIH, and I wanted to do X, Y, and Z. Or I wanted to work over here with EPA and do something else. Wait a minute. We didn't give you a green light to do that. The flexibility is your hands are tied. Unless we can have Congress lower those pillars a little bit so that we have the opportunity to reach across to other agencies, to share ideas, work together, and within that budget be able to support some of our ideas and really share them. And this act was an attempt to do just that. So this is why we do need to have support to bring this one forward in a bipartisan way, so that the One Health, which is human, animal, and environmental health, can be addressed within the agencies. Then you can flip it back down to your state level. And what are the constraints there? And how do they reach across and work within their groups? Back down to your local communities. And when it comes to politics, all politics is local. So when it comes to One Health, if you're not talking to your neighbors, if you're not explaining to them what One Health is about and how we can work together to achieve this goal and do it far more efficaciously if we work together, then when it comes time to having something that might be helpful, such as this piece of legislation or similar things, if they don't speak up, then it's not going to get passed. And so their voices need to be heard. And that's part and parcel, again, of with the One Health approach. I'm so thrilled to see people reaching across and working together because your voices are definitely being heard. And this is what it's going to take to continue to move us forward. So if you really do embrace the One Health approach, then I will have to say it's where all sectors are going to work together. And when you do that, you absolutely do lead and develop the strongest coalition, which is what we want to form, that you can have to address AMR, and that will help preserve our antibiotic effectiveness. It's a whole of society engagement. When you build a coalition, the challenges are to bring disparate groups together, and you can only do that if you're willing to sit down and listen and talk and understand their concerns And the willingness to say, we can have these extremes, and how do you step it forward to say, but we can agree to agree this far, and maybe this far, and eventually we'll get there. And yet, it's so true, especially in D.C., with coalition building. Yes, you bring them together, hopefully you do concur. The following day, you absolutely can disagree, and it's okay to disagree, because we're going to come together on another issue. But I think on this particular issue of AMR, it is truly international, and we do want to have that very strong coalition of all of us bringing our ideas to the table, sharing ideas, and trying things. And I've always said, I'd sooner see you try and stumble than not try at all. And nothing is etched in stone. And only through trying and experience can we direct where we should go to advance this very important approach. So bringing the sectors together brings us the animal and human health, agriculture, our food production, government, non-governmental organizations, our patients, consumers, universities, your pharmaceutical industries, environmental scientists. You can continue. But it's together that we're going to break down these interdisciplinary barriers and really learn from each other, and that way enhance the communication so we're talking the same language. We're not missing each other because we have a separate interpretation of a word or an approach, and yet we have missed that. We don't want to do that. We want to make sure we have this. And by doing that, you really do something that's quintessential. You build your long-lasting relationships. If I walk into a group and I don't know anybody and I say hello and sit down and talk, I haven't really met you. We're breaking the ice. But we've got to come back and talk again and start to share information and work together. You have to work at building relationships. And if you have a relationship, I can't just necessarily take our relationship and pass it to somebody else. You have to work and earn that. And I think trust is important and being able to sustain that. So on challenging issues where there's awfully a lot of skepticism, sometimes preconceived perceptions, you really have to work hard to say, how can we turn the page and together embrace an approach where we're going to see concerns addressed on both sides. And I think the more that we do that, it's going to open the doors to enhance and lead to what we need, which is improved surveillance. Our novel therapeutics hopefully will be developed, and I think we're going to see strengthening of action plans that right now may be on paper, but you in this room and others are going to be the ones that will finally put action to these plans. The timing is now so that the next meeting is, and here's what we did, and here's how we changed course. And that is where we're going to continue to move all of this forward. And it's the implementation of those activities that will demonstrate stewardship at its best. And once again, we have to do international cooperation. So the stewardship is something everyone has a role to play. And so when it comes time to crossing those bureaucratic boundaries, each one of you can be the wonderful agent of change. And with the students, I say you're going to be the ambassadors going forward. But that willingness to first seek to understand and reach out across the aisle, bring the needed expertise to the table, and to collaborate, it's so rewarding and it's so much more efficient to do that. And it also allows us to think outside the box in ways that individually we may not have. And you bring an innovative approach to the table, it's a win across the board. We absolutely have to engage policy and lawmakers. They need to hear from you. They need to hear from all of us as to the issues and what the concerns are. Because they're challenged with prioritization. And it's really hard when so many people are knocking on the door with all of their, this is my major issue, this is my major issue. And we've got to be able to showcase this in a bipartisan way and take it beyond the individual person's health to realizing, as we showcased earlier, this is something that's touching all of us. And the economy is critical for that in all of our nations. And then how do we then help them prioritize? By having and encouraging groups to work together, it's going to actually save dollars and save time. And that's a win. So we can help make their lives and their decisions a little bit easier. And we need to be actively engaged if we're going to have some legislation. Because it's one thing for us to sit around a table and draft something, but if you don't go down to a state and step it down 3 or 4 or 5 layers and check it out, has this legislation, is it something that will hurt you? Will it be something that will benefit you? Have we missed something? What's the gap? And to be able to receive information and feedback, excuse me, and be flexible to change it. It's so critical that we listen and can change things together. And then I think also, as I mentioned, surveillance programs have to be global, and we have to have apples to apples, not apples to oranges. So in this day and age of our internet, that capability is there. The one thing that we're also acknowledging, every single person now around the world, if you meet with them, it's amazing when you say, do you have a cell phone? And just about all the hands go up. If I asked everybody in this room, I'm sure every single person would raise their hand and say, yes, I have a cell phone. But in this day and age, you can be in a country that doesn't have well water, that may not have sanitation, but they have a cell phone. So now we have the capability of apps. You can put an amazing array of apps on cell phones, and you can make the information you're seeking very simple, very basic. But if you start collecting data from all of those sources, it's incredible what's going to come in your front door. So when we say, but I don't have the time, I don't have the money to do something, stop and think, what technology is already there, and how are people utilizing it? And you'd be surprised. This could be an absolutely fabulous way to gather information that we hadn't thought of before. There had been a flood in Ghana, and one of the faculty members from George Washington had gone over there. And while he was standing around, he heard a cell phone ring. And devastation had been around them, but he said, who has that cell phone? And one person raised their hand, and he said, does anybody else have a cell phone? And all their hands went up. And it just made him realize, as I've just said to you right now, there's so many ways we can continue to work with people and share information and gain information. So think about that when we reach out. And I think it's what I said earlier, it's the time now to act, to showcase what we can do. I don't care how small it is. It can be something in our backyard with a couple of producers that are working with their veterinarians. What are you doing? How have you developed a program? If it's surveillance, and be able to showcase and share that. Don't reinvent the wheel. Let's be the ones that can bring this together and make it a little bit easier for all of us. So with that, I think it's going to be my pleasure because Dr. Amanda Bowden is going to be talking next, and she is our director for the One Health Antibiotic Stewardship with the Minnesota Department of Health. And I had gone through and looked at their program. It's available on the internet, and I was very, very, very impressed. She's going to give you an excellent overview of how they have set up what I know is a living 5-year strategic plan where the progress is regularly reviewed and the flexibility to change that plan to improve it is written in. And this is so important. So for them to be able to showcase how you can set something up and make it easy is what we want you to see today. So once again, this is our inaugural One Health Day. More information, as I mentioned, is available online. And I'll leave you with a couple of words. Carl Sagan once said, science is far from a perfect instrument of knowledge. It's just the best that we have. And in this respect, it's like a democracy. Those are profound words. And Dr. Sagan was a brilliant communicator in science. But his words remind us that the science, like democracy, is going to change, develop, and transform. But the direction that it takes is always going to rest in our hands. It's going to be shaped by our desire to contribute to a better world through a One Health approach, seeking optimal health for people, animals, and the environment. And I think together we will, in fact, make a major difference. And I can't thank you enough for the opportunity to share a few ideas. And afterwards, we look forward to an interesting discussion with all of you. Thank you so much.